You know that uncomfortable burning feeling you sometimes get after a meal? Yeah, most of us just kind of brush it off. But what if it's actually a sign of something more going on? Well, today we're going to unpack a super common and often hidden condition that could be the real culprit behind it all, the hiatal hernia.
So is that frequent heartburn, or that feeling of being way too full, or even that nagging chest pain? Is that just something you have to live with? Or could it be your body sending you a really clear signal about what's happening inside? Let's decode that signal together.
Okay, so first up, let's look at the signals themselves. Because, it's rarely just one single thing. It's usually a whole combination of symptoms that paints the full picture.
And believe me, it often goes way beyond just simple heartburn. We're talking about things like regurgitation, that constant feeling of fullness, even after you've barely eaten, maybe some pain in your chest or abdomen, even frequent belching or nausea. See, it's this whole cluster of symptoms that can really point toward a bigger underlying issue.
All right, to really get what's going wrong here, we first have to understand how the system is supposed to work when everything's running smoothly. Think of it like this. We've got to look at the blueprint before we can figure out where the crack in the foundation is.
So just imagine your upper digestive tract as a perfectly designed one-way highway for food. When everything is working like it should, traffic just flows smoothly in one direction, from your mouth down to your stomach. No backups, no wrong turns, no problems. So here's how that highway is built. Food travels down the esophagus. That's our main road. Then it has to pass through this small, controlled opening in your diaphragm, which is called a hiatus. You can think of it kind of like a checkpoint or a tunnel. And finally, it arrives safely at its destination, the stomach. When it all works right, everything stays exactly where it's supposed to.
Okay, so that's the ideal journey. But what happens when there's a glitch in the system? When a part of the machinery literally breaks through a barrier it's supposed to stay behind. Well, that is exactly what a hernia is.
Basically, in the simplest terms, a hernia is when an organ or a part of an organ pushes through the muscle wall that's meant to keep it contained. It's like an anatomical escape artist, an organ on the loose, going where it absolutely shouldn't be.
And that brings us right back to the hiatal hernia. This is specifically when the top part of your stomach, the destination of our food highway, squeezes up through that little tunnel, the hiatus, and pops into your chest. And suddenly, our perfect one-way street has a massive traffic jam. And that physical jam, that is exactly why you might be feeling all that pressure or that uncomfortable sense of fullness.
But hold on. Not all hiatal hernias are created equal. There are actually two main types. First, you have the sliding hernia, which is the most common one. This is where the stomach kind of slides up and down, in and out of the chest. A lot of the time, this might not even need treatment. But then there's the fixed type. And this one is more serious. This is when a part of the stomach pushes through and gets stuck there, permanently. This is a big deal because it can actually block blood flow to the stomach, which is a real medical emergency.
So, we know what it is now, but the big question is, why does this even happen? What is causing the stomach to push its way through the diaphragm in the first place? Well, the causes really fall into a couple of different buckets. On one hand, you've got things that put a ton of pressure on your abdomen. We're talking about stuff like a chronic cough, frequent vomiting, or even straining when you're lifting heavy things. But on the other hand, there are also factors that can just weaken the muscle tissue itself over time, things like aging, obesity, and smoking. And hey, for some people, it's just plain old bad luck. They might have been born with a larger opening to begin with. And that connection to aging, it's a really big deal. Get this, complications from hiatal hernias are seen in a whopping 50% of people over the age of 60. That's a huge number, and it's a super clear sign of how our tissues can naturally weaken as we get older. Okay, so we've covered the what and the why. Now for the really crucial part, what can we actually do about it? Let's dive into how doctors figure this out and what the game plan is for managing it.
I mean, it's one thing to suspect there's a problem based on how you're feeling, right? But to be sure, doctors need to actually see what's happening inside. So what kind of tools do they have to get a peek inside that digestive highway?
Well, there are two main ways they do this. The first is a barium X-ray. It's kind of like putting a tracking device on your food. You drink this special liquid that coats your stomach, and that lets a doctor see its exact location and position on an X-ray. The other method is an endoscopy, and that's exactly what it sounds like, a direct look inside. They use a tiny camera on a super thin tube that goes down your throat so they can see with their own eyes if the stomach is where it shouldn't be.
So once a doctor says, yep, that's what it is, the management plan is usually a step-by-step process. The first lines of defense are almost always changes to your diet and lifestyle. Next up is medication. And surgery? That's typically something that's only considered after those other options haven't done the trick.
The initial goal is pretty straightforward, and there are two parts to it. First, calm down the stomach acid, and second, reduce all that internal pressure we've been talking about. And how do we do that? Well, with medications like antacids to handle the acid, and also by making smart choices with your diet, like steering clear of the usual suspects, things like caffeine, alcohol, and anything super spicy or fatty. Really, it all boils down to one simple guiding principle. You want to avoid increasing that intra-abdominal pressure. Taking that pressure off is the key. It's the whole reason behind the diet changes, the reason to avoid heavy lifting. It's the name of the game.
Now, for those more serious fixed hernias we talked about, or in cases where the symptoms just refuse to go away, surgery can definitely be an option. It's a much more definitive fix, designed to physically put the stomach back where it belongs and then repair that opening in the diaphragm.
And that brings us right back to where we started, doesn't it? With those feelings, that burning, that discomfort. The thing is, they aren't just random annoyances, they are signals. So the real question is, are you listening to what your body is trying so hard to tell you?